Hey, good afternoon, everybody. I'm Steve Carlson. I'm one of the men's health providers at the urology group out of Rochester. I appreciate the opportunity to be here. I want to thank the SMS, the AUA, and our moderators. And we're going to talk a little bit about how to get APPs interested in working in sexual medicine, how to keep them motivated, and how to make it work. I don't have any pertinent disclosures. So not all APPs are going to be interested in working in an area that involves a lot of procedures or even sexual health, but I think it's something that you would negotiate with them. So how can you get them interested, get the engine running, or start the rock rolling down the mountain, and you want it to grow and let the momentum build, and you want to keep them engaged so they want to stick around. Now, if I take a step back and look at who are the healthcare providers that are patients coming in to see in clinic, nationwide, all physicians, you're at about 1 million. APPs, you're at about 340,000. So therefore, when someone walks in the door in a clinic, you've probably got about 3/8, 30% chance that you're going to encounter an APP. If you look at urology, it's a similar ratio. About 14,000 urologists. That number of APPs is old. It's probably around 10 or 12,000 now, which you have a good chance of encountering an APP in a urology practice. And if you look at all practices in urologists, 4/5 do work with APPs, more common in urban areas and in academic settings. Now, if you look at is there interest in APPs working in men's health, I think it's a definite yes. Looking at the SMS numbers over the last several years, if you look at APP memberships, in 2019 there were 72 members. Last year there were 283. For APP attendance at SMS, you had 39 show up in 2018 and over 100 show up last year. So there's definitely growth and interest for a variety of reasons that we'll talk about a little bit more shortly. If you look at reimbursement for procedures, there are definitely more APPs doing more procedures now than there were a decade ago in a variety of different areas. Anything from cystoscopy, sizing ultrasounds, ultrasounds for ED, things like that. So there's a growing interest and obviously a need that our patients expect to get from us. So how do we get the ball rolling? Well, it depends on where you start. Obviously, you have to look at the skill set, experience, and abilities of the person that you're working with and get a good foundation. What is a good foundation for general urology? I don't know, it's going to vary. Some people will pick it up in a matter of 6 or 12 months and be quite versed because they come with a good background. Other people, it might take a little bit longer, especially if they're newer. There are numerous resources to teach people more about sexual health, whether it's journal articles, journal clubs, in your urology practice if you're working with residents. There's many resources from the AUA and SMS. There's online activities that you can do. There's great support from Coloplast and Endo and Boston to get people interested and learning more about these things and figuring out what's going to work best for them. So I don't think there's an excuse for not having enough resources. But remember, not all APPs will be interested. You just kind of got to feel them out. So once that seed is kind of planted, how do you get it going? It's great to learn more about how to treat a lot of these conditions, but how do you maintain the engagement? Well, you kind of broaden the skill set. Do you want to learn how to do cystoscopy? Are you interested in ultrasound? How much do you want to be involved in the operating room? After that, what are your interests in education? Do you like thinking about educating other people? Do you want to get your name on a research paper? What type of involvement do you want to have outside of work? I always think in my head, conferences are more for just attendance. I have some friends who just like to go to conferences, they show up and then they bounce on out, but they don't actually really engage or have like a deep involvement in being an active participant. And I think that's just a difference in personal opinion and their own goals. From a learning perspective, APPs shouldn't really be much different to train than residents. I don't think the see one, do one, teach one philosophy is particularly effective, but I don't think that it will be different than any of us have already learned how to do certain procedures. So why is this important? Why do I bring this up? Who cares? What are we really focused on? Well, one thing is APPs are expensive. I mean, that would be like the paycheck gross salary to pay an APP, not total compensation. But I think the scarier number is the cost to replace an APP. So looking at a registered nurse, if you wanted to replace a registered nurse who left your department, it's going to cost you about $100,000. For an APP, it's probably going to be more, but probably less than $300,000. And that's going to include your recruitment, your onboarding, your training, the time taken away from other providers to train the new provider. And it's a hassle. Nobody wants to do that stuff all the time. And the patients don't always want to be seeing a new face. So there should be a good emphasis on maintaining a strong relationship and engagement with your APP because you want them to be long-term. What can you do to help promote that? I think a lot of it is emphasis on a team approach with equal contributions, and this is not just the providers, this is everyone. This is everyone who answers the phone, rooms the patients, the techs, the registered nurses, the LPNs, everyone in the chain knows that their contributions are equal, but different based on their skill set. I think camaraderie and gratitude and appreciation is incredibly helpful. You know, something like, you should know each other well enough that when you see each other at the grocery store, you can strike up a conversation and maybe even remember the names of their kids. You know, you want to have a group that you enjoy working with. I like to use the analogy of everybody's got to eat their vegetables, right? So I remember thinking, if you get a patient that comes in oncology and they get a nice juicy 2-centimeter exophytic renal mass and they're a great robot partial patient, the surgeon's going to be very happy. But it's not all just meat and potatoes or juicy cheeseburgers. Everyone's going to get the occasional less desirable indication, and you don't want to take all of those indications and put them on a single individual or a small group, especially things that are very hard to cure. And you want happy patients. And so in order to do that, everyone's got to kind of have a variety. Everyone's got to kind of see some of the undesirables to spread it all around. But if you do that, everyone's going to get a nice square meal, and it helps keep people happy. The last slide I have here is pointers for APPs that are wanting to get more engaged. So what can you do for yourself? You want to make yourself invaluable by developing unique skill sets that will enhance what you can do, not only to help your patients, but to help the practice as well. I use the term get comfortable being uncomfortable. I remember what it was like the first time I scoped somebody. I remember it was like the first time I put into testosterone pellets. I remember the first time I actually got my hands wet and did the vasectomy and actually got the vas up on the first try. And so, but you have to go through this uncomfortableness of the little bird peeping out the nest with the mama bird kind of kicking it off the edge, because there's the only way you're going to learn and try to be more dependent. So you got to get a little bit uncomfortable, a little bit more comfortable being uncomfortable, and you want to be involved. Get involved with whether it's forums online, networking, involvement with conferences. I use the expression, don't say no to new experiences where you learn new skills. I don't mean that to say yes to everything, but at least take advantages of opportunities if they present themselves. I think the last sentence is very important. You don't get what you deserve, you get what you negotiate, so you have to advocate for yourself to try to advance and accomplish more. And I thank everybody for their time.